G'day guys, Ian from Cookie's Critters, and today we're talking about femoral pores in bearded dragons. Should we squeeze them? Are they blocked? How do I identify them? How do I treat them? Now guys, if you are new to this channel, please do us a favor, hit that like button, subscribe to the channel, turn on those post notifications, and we'll get started just after this intro. Okay guys, so today we are talking about femoral pores in bearded dragons. Now guys, all bearded dragons do have femoral pores. The main difference between male and female is that boys will have larger and more predominant femoral pores across their legs on the underside, from kneecap across top of the vent to the other kneecap. Now guys, females will have femoral pores, but they will be very discreet. Now these femoral pores are the exit channel from the femoral gland. Now the femoral gland is the pheromone production center for bearded dragons. It is their way of marking their scent, like a cat or a dog would when they mark their territory by urinating. The way they do this is the scent gland excretes a waxy substance, and this waxy substance, when rubbed upon any hard surfaces, whether it be the substrate, the rocks, the branches, the backgrounds, the decorations, the hides, whatever's inside their enclosure or in the wild in their natural habitat, lets other dragons know what dragons are in the area. In particular, males that are territorial and they are trying to mark and claim their territory. And for males during breeding season, it lets females know what male is ready. Now studies have been conducted, and the evidence has been proven that a bearded dragon will be able to tell by the scent from those pheromones the age, the gender, and the overall health and condition of the bearded dragon in that area. So guys, I've got Lemongrab here today, and he's going to be the first little model for this demonstration as to where femoral pores are located and what we're looking for. So guys, like I mentioned in the introduction, the femoral pores are located on the underside of the dragon, from the kneecap across the cloacal vent, all the way across to the other side, to the other knee. Now guys, I will put a picture up here because it's hard to zoom in on the camera here while I'm filming, to show this current state of Lemongrab's femoral pores. They are empty, they are in really good condition, and the next little beardie that I will get out, one of the other boys, I will show a different state, a different condition of femoral pores that we need to start treating before it gets to a point where they are impacted and possibly need a veterinarian to give medical intervention. Okay guys, so we have Littlefinger here. Now he is a 2-year-old central bearded dragon, and overall his femoral pores are in really good condition. There's maybe 2 or 3 that are starting to get a little bit impacted. Now the way that we can tell that a femoral pore is impacted is when we rub our finger over the area where the femoral pore is. If it's just slightly proud and it's just slightly hard, yeah, it's not so bad. We can give that a toothbrush and a warm soak and that will come off. But when we know it's impacted, is you will feel a hard lump, almost like a hard plug, maybe 2, 3, 4, 5 mil long, traveling up into the leg. That hard mass is the impacted femoral pore. Now on this side here, it is just here. So we can just slightly see that this femoral pore is impacted. It has a hard mass protruding, and you can also see going up diagonally towards the crease of his hip here that there is a hard mass. Now this is the one that I'm concentrating on, and this is the one that we're going to be working on today. We will give him a general overall brush with the femoral pore treatment, and we will go from there. Okay guys, so while we're getting this set up, the things that you're going to need is a little bucket like this. I never recommend bathing or soaking a bearded dragon, or any reptile for that matter, in your hand basin, your kitchen sink, your bathtub, all these kind of places. places where you are preparing food, places where you are doing your own hygiene routine, it's not a good idea to be cross-contaminating between human and reptile. So guys, get yourself a little tub, set it aside just for your reptiles. And another thing that you will need is a little soft bristled toothbrush. Simple guys, obviously don't go pull it out of your own bathroom or your kid's bathroom. Get one just for your reptiles. So guys, in the bucket, if you have to bathe or soak a bearded dragon, never use hot water. Obviously, hot water is going to create stress for the bearded dragon and potentially you're going to dehydrate the animal as well. On the flip side to that, we don't want to use cold water either. They are ectothermic. They do require an external heat source for them to actually regulate their body temperature. So the way I like to recommend to my customers is do the old elbow dip test, the way that you would test the water for a baby if you were bathing your own child. That mid-20s, 25 degrees Celsius, that is the temperature you want to aim for when you are soaking your bearded dragons. Okay guys, so Littlefinger is now in his little bath and he's soaking away. Now, things to pay attention to is the depth of the water level. We only need the water to go just beyond the crest of the hind legs of their hips. Guys, we're only soaking the femoral pores. We don't really need to concentrate on making it any deeper than that. Now, obviously, you want the dragon to be relaxed. You want them to be calm and be, not stressed. So guys, this is where the ideal temperature will come into place. Now, what we want to do is we want to achieve around about a 25 to 30 minute soak time to help us soften these pores before we get in there with a toothbrush and slowly start working them away. Now, I will do a bit of a cut scene and we'll skip ahead 30 minutes.
A few moments later.
Okay guys, so 30 minutes has now elapsed and we're ready to start brushing the femoral pores. Obviously, try supporting your dragon as well as you can. I've got a nice good grip between the index, the root finger, the thumb and the little finger. And we need to do a downwards motion when it comes to brushing the scales. Obviously, we don't want to brush against the grain. Now guys, we want to limit the amount of time that we're doing this. Obviously, it's not a natural or a comfortable position for a bearded dragon to sit in. So be considerate of that and be considerate of their level of stress, okay? So if your dragon starts unnecessarily getting stressed out, please stop, give them a minute, and then continue back with the brushing. So guys, the trick with this is when you're looking at the plug on the femoral pore, obviously if it's a dark yellowy color, then it is a old solid pore, and essentially a healthy pore will be almost empty, completely evacuated, or it will have a very pale white mucousy kind of plug. This is what we're trying to work on, and all we're trying to achieve is just softening these femoral plugs. We aren't trying to squeeze them. We aren't trying to pull them out. We need to soften them, guys. If you try to squeeze a femoral pore right now, you are going to hurt your dragon. If you try to get a pair of tweezers and just pull them out, same deal. You're going to hurt your dragon. What we need to achieve is softening these pores. Okay guys, so that's been about 5 minutes worth of brushing. Now, obviously, like I said before, the aim isn't just to pull these plugs out. So if during this process any of the plugs do come out, that is perfectly okay. If you notice any redness, swelling or bleeding coming out of the femoral pores, I do recommend you stop this process immediately. Get down to your local reptile veterinarian, get someone to have a look at it, maybe some antibiotics or maybe even some kind of surgical intervention. If you do notice that one of these plugs do come out, simply just get some Neosporin or some coconut oil and we can just apply that onto the underside of the legs, and that will keep it free from infection. So at this stage, I'm going to put Littlefinger back in his enclosure and we're going to try again tomorrow.
the next day.
Okay guys, so it's day number 2 now. Littlefinger has been soaking in the tub for the last 30 minutes again today, and we're gonna work on the same things that we were working on yesterday. Soft toothbrush, warm water, let the dragon soak, and easily sort of work on those femoral plugs. Now, I have checked the condition of the femoral pores. None of them have come out since last night, so we'll work on it again today. Guys, this is a procedure that does require patience. Softening these femoral pores, brushing them slowly, doing this in a conservative manner can take between 3 and 5 days. It can even take up to a week. So guys, be patient, be persistent. Your dragon will thank you in the long run, not requiring surgical intervention. Okay guys, so this is the end of day 2. Once again, keeping it down to about a 5-minute little cleaning exercise. The femoral pores are looking better, but when we slowly massage the underside of his legs, you can see just between my fingers where the femoral pore is, there's also a hard little mass traveling up towards the crease of his hip there. Now, same down here. We can see that there's 2 little hard masses coming up, and these are the impacted femoral pores. Now guys, overall the other ones have softened quite considerably, and I'm not so concerned. This one here is maybe a little bit blocked, but we will put him back in the enclosure for now, let him have a rest for today, and we will continue again tomorrow. Okay guys, so it is now day 3 and Littlefinger is about to go for his bath. We have checked his femoral pores, and overnight 2 of the plugs have actually come out. So I'll put a picture up here of what the extracted pores look like, and one of the plugs is almost protruding all the way out. Now, before we do soak him for another 30 minutes, what we're going to do is we'll show you what it looks like, but we'll also show you how you can manage it. So it is this one here, right where my middle finger is, and I will put the picture up here so you can see a close-up of it. But essentially the actual mucus plug has now self-evacuated, and we can just use a fine pair of tweezers and just pull that little plug out. So guys, simply pair of tweezers, grab onto the head of the plug and pop, out it comes. Okay guys, and so here we have it. Here is a extracted femoral plug. Now guys, the way we know that this one was impacted is because the part that has come out is completely yellow. It is rock hard. Now guys, that was never going to come out by itself. We will let him soak for another 30 minutes and we'll come back to this treatment shortly.
More moments later.
Okay guys, so it's almost been 30 minutes. Littlefinger here is telling me he wants out, so we're going to get him out a little bit early, and we're going to start with brushing his femoral pores. Okay guys, so looking at the femoral pores here, there's still about 5 or 6 femoral pores that are still somewhat impacted. Now guys, we are going to work on it with the soft toothbrush for the next 5 minutes, and after that we'll assess from there. Okay guys, so he's a little bit stressed out today. We let him have a little rest, and then we'll continue once he's had a few breaths and he's calmed down. Hey guys, so Littlefinger's had his femoral pores brushed for the last 5 minutes, and with the exception of 1, 2, 3, 4, 5, all the femoral pores are unblocked and completely extracted. Now, obviously this little one on the inside thigh up near the knee here doesn't have any concern to it. It is soft. It is quite white, not yellow or dark. So I'm pretty confident that one will come out by itself. The 4 above the cloacal vent just here, to me, are still quite heavily impacted and will need to be evacuated. Now guys, at home, I highly recommend getting a veterinarian to do this procedure. I never recommend popping, squeezing femoral pores. Guys, if you don't know what you're doing, you can easily damage the femoral gland. So guys, please do take your beardie to a vet if their femoral pores are blocked and need to be evacuated. Okay guys, so that's it. After 3 days of bathing and brushing, we were fortunate that a few of them came out by themselves and that a few of them were protruding enough that we could get a pair of tweezers and gently remove them. Now guys, the finished product is his femoral pores are all unblocked. There's no protrusions, there's no hard masses, very healthy femoral pores now. Now guys, the next one we're going to talk about are seriously impacted femoral pores. Now guys, later on there will be a few pictures coming up that are pretty grotesque and pretty graphic. Viewer discretion is advised in this one. But this is where we can no longer do home management and home treatment. We need to get medical intervention from a reptile veterinarian. So guys, I'm going to put this little fella back for now, and we'll get cracking on that next one. Hey guys, so how do you know if your bearded dragon has heavily impacted femoral pores? Well guys, I'm going to put some pictures up shortly of some of the worst cases I could find across social media and across Google. Now guys, please do be warned, some of these images are grotesque and some of them are graphic in nature, with some surgical procedures being required to treat and intervene with these femoral pores. So guys, as we can see with these pictures, there are bearded dragons here, and the femoral plug has exceeded and has protruded outside of that paw, you know, by the best part of 1/2 centimeter to 1 centimeter, and it is a hard-like mass, almost like a hard maggot or a hard worm. Now, other things to note is that in these pictures, it is clearly obvious that you can see infections through the redness around the femoral plug, the swelling, and potentially some of the bleeding cases. So guys, obvious signs are swelling, redness, and bleeding. Pain to touch, obviously, as well. But if your bearded dragon has any of these symptoms when it comes to their femoral pores, this is when you need to have a veterinarian have a look at your beardie and give their advice of a management plan. Potentially some surgery may be involved. Now, the next picture coming up is where a bearded dragon did need that sort of next level of intervention through the veterinarian, and surgery was required. Now, in this situation, the beardie was sedated and the veterinarian used a syringe to slightly enlarge the opening for the femoral pore. This way they could make the extraction a lot easier. Now, as we continue through the photos, we can see the series of pores have been evacuated, and finally we can actually see pictures of what those hard masses looked like. Now guys, if your bearded dragon was only at the stage where it needed some gentle brushing and some gentle soaking, it didn't actually need forceful extraction or it didn't need medical intervention by a veterinarian, then you can simply put your bearded dragon back in their enclosure and they will manage just fine without the risk of repeat impaction. Now guys, at this stage where a veterinarian has done surgery, potential antibiotics would be administered, some kind of oral medication to keep down the infection. Now we need to strip out the enclosure. We need to bring it back to a sterile state, almost like a rehabilitation ward in a hospital. We need to take any substrate out, we need to take out decorations, branches, climbs, hides, all that kind of stuff, and keep things as sterile as possible. Now to do this, we simply recommend either butcher's paper or newspaper. Simple, easy products that you can just rip it out, chuck it in the bin, put new stuff down, and it's fresh and it's clean. We want to keep this environment as clean as possible for this bearded dragon during its recovery. So guys, how do we prevent our bearded dragons getting further impactions down the track in their femoral pores? So guys, like I mentioned in the introduction, in the natural habitat for a bearded dragon, they will drag their hind legs up the branches, across rocks. As they're digging, they will also kick back with their hind legs, and this scratching, this coarse abrasion from the substrate below, which is still a sand and clay based substrate, helps wear back and keep those femoral pores unblocked. Now guys, further to contrary belief, sand does not cause impaction. Sand will assist keeping the impaction at bay by using that natural abrasion. Causes of blocked femoral pores are the absence of coarse things inside their enclosure for them to wear away. So your coarse rocks, your coarse branches, your coarse substrate, such as sand. And guys, one of the most obvious one comes down to poor husbandry as well. Guys, a lot of medical conditions around bearded dragons solely revert back to us as the keepers not doing our job and not keeping their enclosure clean enough. Now guys, obviously if the humidity is too high, if the temperature is too low, if the substrate is dirty, all these things are going to add up to your bearded dragon getting a femoral pore impaction, and worst case scenario, an intestinal impaction if you are using loose substrate. So guys, keep your heat up, keep your humidity down, keep your enclosure clean. Okay guys, so that's it for today's video. I hope you did enjoy it. I hope you learned something new. Guys, please do remember, do not squeeze their femoral pores. If this needs to happen, get a veterinarian to do it. Guys, if you enjoyed the video, make sure you hit that like button. If you haven't already done so, subscribe and turn on those post notifications. That way you're not going to miss a coming video. Guys, all the discussion points from today's video, I have got a written blog. So if you've missed anything, if you want further clarification, please jump across to our website. The link will be in the bio below to our blog about blocked femoral pores. Now guys, as always, if you've got them, keep your beard treated and your beard is heated.